2026 brings crucial updates for Americans who depend on federal and state benefits. Understanding how Medicaid, veterans' disability compensation, and Social Security disability payments are changing is essential to protect coverage, maximize income, and plan finances effectively. Medicaid continues to be the cornerstone of healthcare access for low-income adults, children, pregnant individuals, elderly adults, and people with disabilities. Eligibility varies by state, but all programs adhere to federal guidelines that tie income limits to the Federal Poverty Level, FPL, and Supplemental Security Income Standards. Many states allow adults with incomes up to 138% of the FPL to qualify under Medicaid expansion. States also determine specific resource limits, with some offering spend-down programs to help individuals with higher medical expenses become eligible. In 2026, states are implementing new federal provisions to simplify enrollment and renewals. Many will conduct eligibility redeterminations more frequently, sometimes every 6 months instead of annually. This requires beneficiaries to ensure their personal, income, and contact information are accurate and updated. Missing documentation or failing to respond promptly to requests can result in temporary loss of coverage. Medicaid coverage interacts closely with other programs like Medicare and SSI, making coordination vital for those enrolled in multiple benefit streams. For veterans, the Department of Veterans Affairs confirmed a 2.8% cost of living adjustment, COLA, for 2026. This increase took effect December 1, 2025, and is reflected in monthly compensation for service-connected disabilities throughout 2026. Veterans with higher disability ratings, such as 100%, will see monthly benefits rise from approximately $3,131 to around $3,938. Veterans with lower ratings also receive proportional increases. These payments are tax-free and can significantly improve household finances for veterans and their families. Veterans may also qualify for additional compensation for dependents, including spouses, children, and dependent parents. These dependent allowances increase alongside base disability payments, providing extra support for families. Veterans considering applying for disability compensation or updating their existing claims should maintain thorough medical records and documentation to maximize benefits and reflect any worsening conditions accurately. Social Security Disability Insurance, SSDI, and Supplemental Security Income, SSI beneficiaries also receive the 2.8% COLA increase for 2026. This adjustment ensures that disability and retirement payments maintain their purchasing power against inflation. SSI individual payments are now approximately $994 per month, and couples receive $1,491. SSDI monthly benefits rise from an average of $1,586 to roughly $1,630. These increases help cover housing, food, transportation, and medical costs without requiring additional applications from recipients. Medicare Part B premiums will increase to approximately $202.90 in 2026. This change affects net Social Security payments, particularly for retirees who pay premiums directly from their monthly benefit. Beneficiaries should review their statements to understand how deductions impact overall income. Coordination between Medicaid, Medicare, and VA health benefits can fill gaps in coverage, especially for prescription medications, long-term care, and specialized medical services. Beneficiaries of multiple programs must ensure all personal, banking, and income information is current. Agencies rely on accurate data to process payments correctly and prevent delays. Direct deposit accounts must be verified, and online accounts with SSA, VA, or state Medicaid offices should be monitored regularly. Responding promptly to agency notifications prevents interruptions in benefits and ensures full 2026 payments. The 2026 benefit updates reflect efforts to keep support aligned with rising costs, protect the most vulnerable, and simplify access to healthcare and financial support. Knowing payment dates, increased amounts, and eligibility rules allows beneficiaries to plan budgets, cover essential expenses, and maintain financial stability. Acting proactively prevents lapses in coverage and ensures every eligible individual receives the full benefit they are entitled to. For Medicaid recipients, reviewing state-specific guidelines, renewal schedules, and eligibility criteria remains crucial. Veterans should track VA announcements for updated compensation rates, dependent allowances, and supplemental benefits. Social Security and SSI beneficiaries need to confirm their COLA-adjusted payments and verify how premium deductions impact net income. Monitoring all these elements together ensures that individuals receive consistent, uninterrupted support throughout 2026. Coordination, preparation, and awareness are key to maximizing benefits in 2026. Understanding how Medicaid interacts with Medicare, knowing the updated VA disability rates, and reviewing Social Security disability payments empowers beneficiaries to protect themselves financially and access necessary healthcare services. Early verification, accurate documentation, and attention to agency communications prevent disruptions and enhance quality of life for seniors, veterans, and people with disabilities. These changes will directly impact millions of Americans who rely on these programs as their primary source of financial security and healthcare coverage. Being informed about every adjustment, from COLA increases to state-specific Medicaid rules, ensures that payments are received timely, coverage continues without gaps, and financial planning is accurate. Staying proactive is essential for safeguarding benefits in 2026. Beneficiaries are encouraged to maintain organized records of all benefit-related correspondence, confirm eligibility annually, and contact agencies immediately if any discrepancies or notices appear. Keeping all accounts updated prevents payment errors, reduces stress, and ensures the increased 2026 benefits reach the right recipients. Health, financial stability, and access to essential services all depend on this careful attention. The 2026 benefit updates for Medicaid, VA disability, SSDI, and SSI represent both continuity and improvement. While payment increases are modest, they reflect essential protection against inflation and cost of living pressures. Careful planning, awareness of deadlines, and accurate record-keeping allow recipients to maximize every dollar of their benefits and maintain stability throughout the year. Understanding and acting on these updates is not optional. Every adult reliant on Medicaid, Veterans Disability, or Social Security disability programs should confirm their information, review their 2026 payment schedule, and ensure compliance with all documentation requirements. The combination of COLA increases, Medicaid expansions, and streamlined VA administration provides opportunities for better financial security, but only for those who actively manage their benefits. Remaining vigilant in 2026 means checking official sources regularly, keeping copies of all notices, and seeking help from benefit counselors if questions arise. This proactive approach ensures uninterrupted access to health care, consistent financial support, and peace of mind for seniors, veterans, and people with disabilities across the country. The new benefits landscape for 2026 is clear. Stay informed, verify your information, and claim every increase in payment to which you are entitled.